Dr. Edward Apicella is a pain management expert, and he's very clear about limiting the use of narcotics to relieve pain.
30 days should not be prescribed for acute pain or for post-op pain.
7 days max, says Dr. Apicella, because for some people, 30 days is all it takes to get hooked. Opioids act on a specific receptor in our brain.
The receptors change, and what you end up with is a narcotic or an opioid that is actually worsening the pain instead of getting it better.
So before an opioid is prescribed for long-term use, Apicella says other options should be tried, including non-narcotic analgesics, exercise, physical therapy, acupuncture, antidepressants and anticonvulsant drugs, behavior modification interventions. Too often, he says, doctors not schooled in pain management write opioid prescriptions inappropriately, a big part of how we got into this opioid crisis. In 1996, the Veterans Administration, along with the Joint Commission on Accreditation of Healthcare Organization, JCAHO, and the American Pain Society, introduced the phrase pain as the fifth vital sign. The other vitals, blood pressure, heart and respiratory rates, and temperature. Doctors were encouraged to treat pain, but pain is a symptom that can't objectively be measured. The result of treating pain, Apicella says, skyrocketing opioid use. Consider Kelsey Murphy's experience.
When I started prescription painkillers, that's when I was at the age of 17.
It was a legitimate prescription you got.
That was a legitimate prescription that I got for strep throat.
By 19, she was hooked on prescription painkillers. At 22, she entered her first rehab. Now 27, she's a mom and warning others about the drug spiral she never thought she'd get caught in.
The prescription painkillers led to, I think I was 21 when I started using heroin.
Sadly, Kelsey's story is not unique. That's why Dr. Apicella says when an opioid is prescribed, it should be at the lowest possible dose and only after the patient is carefully screened.
You have to assess their behavioral issues if they have any, depression, anxiety, borderline personality disorder.
He acknowledges some doctors still give in to patients who browbeat them into writing an opioid prescription. He's clear that has to stop. And yes, there's the issue of unintended consequences. That as we tighten opioid prescriptions, those already addicted move on to street drugs like heroin.
I think the first step is not creating the addict.
That's something the medical profession must take to heart, and then,
no matter where you attack this, unless the education improves, the prescription writing is tightened down, and the illicit drugs are limited, we're always going to have a problem.